Hello, Professor. Hello, classmates. My name is Eric Williams, and today I will be giving an informative speech on socialized medicine in a capitalistic world. My emphasis will be on disease management in the United States and how we can improve upon it. My special guests today are Jada Williams. Say hello.
Hello.
And Easton Williams. Easton, say hello.
Hello.
And these will be my guests today, and will be witnessing my speech. Again, my name is Eric Williams, and I'll give you a brief resume. I've worked in the medical field for approximately 7 years now. I've worked in a number of capacities. I've worked as a EMT instructor. I've worked as a phlebotomist, as a CPR and first aid instructor for Ivy Tech Community Colleges in Indianapolis. And I currently work as an occupational health manager for Amazon.com. So let's hop right into it. Socialized medicine in the capitalistic world. Now, I understand that the word socialized or socialism is a very inflamed word today because of the political spectrum. But what I mean by socialized healthcare or socialized medicine is simply using the government to fund private enterprises, and so that those companies can innovate and create and then sell their goods and services back to the government. And then the government distributes those goods or resources to the masses. So that's what I mean by socialized health. Now, countries that are currently using this system are Cuba, the Netherlands, France, Canada. And if you actually look at the demographics, these countries are a lot healthier than Americans would either believe or know. Now, why is that? Well, that's because they focus more on the preventative side of healthcare versus the treatment of illness and symptoms like we do in the United States. Now, according to a lot of specialists, socialized medicine works, but it has some strings attached to it. It has its weaknesses. And the main weakness of socialized medicine is that socialism in itself breeds stagnation. What does that mean? That simply means that socialism or socialized medicine doesn't innovate very well. It's very hard for scientists to come up with different cures or treatment of ailments because the money is not there, even when the government funds it. Because you have to have a capitalistic mind in order to take advantage of innovations. And that's just a fact. So I'm not demonizing capitalism because you need it. But what I'm saying is that the socialized system works if it's worked properly. So let's talk about capitalism and why I feel it's not the best healthcare system in and of itself. Because we tried it here in America. In the 1940s and the 1950s, the country went through a change when it came to EMS, or when it came to ambulance, rather. What they noticed was that prior to 1960, the ambulance services, first of all, they weren't ambulance services, they were mortuary companies who specialized in transporting individuals to the hospital. The problem with this was that the individuals were dying in their mortuary vehicles, and then they were taken back to the funeral homes. Their bodies were prepped, and then the loved ones would have to pay for that mortuary to bury their loved one. Now, there's nothing wrong with that, but the issue is that the mortuaries made their money off of dead people. So anytime you have a company that makes their money off of dead people, they need dead people. And so it's very easy for them to let individuals die in their ambulance. And when the government did an investigation, they noticed that there was a higher mortality rate of individuals who were picked up using these mortuaries and transported to the hospital than when individuals either took themselves or had a loved one take them in their own private vehicle. After that, the government published what's called the white papers, and the EMS system was created. And now the EMS system is run by municipalities or governments or cities and things of that sort. So that's what happens when you have a totally capitalistic healthcare system. People die. And if people don't die, then the symptoms of a disease or the symptoms of a trauma are treated, but the person is never fully cured. Because there's not a lot of money in curing a disease. Because once it's cured, then you're not making any more money. So as long as you treat the symptoms, you can make money, because you can always innovate on symptoms. You can always give more medications. Now, this isn't a conspiracy. This is just simple. This is just simple logic. So let's talk about the preventative side. I'm currently trying to seek a degree in preventative disease research, and what you'll notice is that there's more money, or there's more money to be saved using preventative measures than treating symptoms. For example, if you can treat diabetes before it turns into diabetes, think of how much money the government saves. So much money. To give you a fair example, every month an individual on Medicaid or Medicare or VA or on some other type of government assistance spends approximately $300 a month, or the government spends $300 a month on their treatments. For that price, you could have someone who isn't on diabetes go to a gym or invest in healthy lifestyle alternatives for less than $50. $20 to $30 for a gym membership, and maybe $10 or $20 for transportation stipends. So you're looking at $50 to $60 on the preventative side versus $300 to $400 a month on an individual who already has full-blown diabetes. And that comes with like your glucometer, your glucose, your test strips, visits to and from the doctor on a monthly basis if need be. So there's more money to be saved using preventative disease alternatives. You look at individuals who have cardiac issues. Somebody going through cardiac surgery, you're looking at maybe $200,000 to $300,000 surgery. Where if you, let's say, invested in healthy alternatives, even if it was government funded, you would save so much more money. For $300,000, the cost of a heart transplant, did you know you could pay for 350 individuals to go to the gym for the rest of their life? That's huge. That's huge. So there really is something to be said about treating the disease beforehand. Other things we can do to help with preventative disease are reduce the amount of junk food individuals on public assistance can get. Now, I know this is very controversial, so let's think about it. We already control food stamps in regards to buying alcohol. Why not say we're going to limit individuals on food stamps to how many sodas they can buy per household, or how much junk food they can buy? We already know that that lower income communities have a higher death rate. They have a higher disease rate, especially in preventative diseases like cardiac, cardiopulmonary, cardiac infarctions, and diabetes. So if those communities are already using public assistance, then isn't it the public or the government's responsibility to make sure those individuals are healthy, or at least are steered down the right path? What about individuals who receive free lunch? What if we can control what kind of food they ate? What if we gave them only healthy foods? What if we cut the chocolate milk? What if we cut on cookies and things of that sort? Think about how many lives we could save. We've already talked about the other weight loss initiatives. What if we invested in more vitamins and more nutritious meals and things of that sort? Think about how much better off we would be. Yes, it would be a cost up front, but the cost of preventing a disease is so much cheaper than treating the symptoms of the disease once it's progressed. It's just simple logic. So what can we do about it? How can we change things? or at your local congressman or congress-lady. Let them know that you're for socialized medicine in terms of preventing diseases. Countries like Canada and Japan and Cuba are healthier than us. They have a lower death rate. They have a lower infant mortality rate. They have a higher standard of life in regards to their health. So what they're doing is working. Socialized medicine works, but it takes a collaboration from either your state or federal government working with private enterprises and companies in order to come together to make it work. So that's all I have to say about this subject. I thank you all for listening, and I hope you all have a great day. Professor, I hope you enjoyed this speech. Thank you. And Jada, I want to thank you. Can you say hi?
Hi.
And Ethan, I want to thank you. Can you say hi?
Hi.
All right, well, from all of us here at this household, I want to thank you and have a good day. Bye-bye.